Our vision is better health through laboratory medicine, and our vision is actually the definition of health equity. Health equity just means that everyone has the resources in order to obtain their optimal health. So when you think about optimal health and you actually prioritize health equity, then what you're doing is you're addressing any of the root causes that are inequities. And laboratory medicine does that on an everyday basis. And so during my presidential year, I really want us to be intentional about how we deliver care, thinking about our communities that we serve, thinking about the diagnostics that we provide for them, even thinking about how we interpret tests, and if there are biases or stereotypes that may lead us down one direction when in fact the patient may need you to lead them down another. I also hope that we really are intentional about developing educational content that really helps us unlearn some of the atrocities that have informed medicine and how medicine is practiced. So I'm really excited about us being able to realize the vision for ADLM. So there are a couple of things I would like to accomplish during my presidential year, and I know for a fact that with the support of the board and the CEO and the membership as a whole that we can make this possible. One is we truly need to extend upon our strategic plan. Our strategic plan needs to incorporate several things, one of which will continue to highlight the value of laboratory medicine. And doing so, my goal is to really put into place a mechanism in which clinical chemists, non-medical physicians have the ability to bill for testing, many of which we not only perform, but then interpret that's being used for patient care. Two, it's very important that we embed the principles of diversity, equity, inclusion within our strategic plan. And at some point, I hope that I don't even have to use the word DEI because it's just part of our culture. Three, ensuring that we're not only recruiting more clinical laboratory scientists, but we're also ensuring that they're completely infused within our governance and any and all activities that ADLM holds. Working in this space of diversity, equity, and inclusion, many times we think that this is a modern take, that it's just come about. But actually, DE&I initiatives and principles have been infused by the social sciences for many years. And so when we really think about what diversity, equity, and inclusion embodies, it really embodies us knowing what our community is. So if I go into a community and I don't know the incidence of disease or chronic illnesses, then I'm not going to be able to provide a test menu or even a diagnostics that's appropriate. A good example is understanding that some individuals, they have barriers to getting to the clinical laboratory. And so using some of our point of care devices to actually bring the testing to them is a really good example of how we make sure that we're providing the needs of the community.